Globally, obesity is climbing to epidemic amounts. The number of children who are obese or overweight is growing rapidly. The World Health Organization defines being overweight or obese to be abnormal or excessive fat buildup that presents a range of different health risks. Being overweight or obese are major risk factors for various chronic diseases such as diabetes, cardiovascular disease, and even cancer. Childhood obesity is one of the most serious public health challenges that we face today. It is a global issue that affects low to middle income countries and even those who are in an urban setting. Globally, it was estimated in 2013 the number of children under 5 who were overweight was projected to be over 42 million. 31 million of those were in developing countries. Being overweight or obese is preventable, and in order to prevent obesity in children, it needs high priority. Research has shown that 1 in 4 children are overweight or obese, and is now the second highest contributor to the burden of disease in Australia. Kids who are faced with being overweight or obese often find themselves at risks of not only health problems but also mentally. It is important to approach childhood obesity with an understanding of social stigma that these children face within the school settings and also at home. This has been proven to have an emotional and physical consequence towards their health. They are often teased and excluded from team activities, which in return may lead to lower self esteem issues, negatively towards their body image, and even depression. Stigma is a sign of humiliation that sets a person apart from others. Having stigma and discrimination towards any obese person is prevalent and can pose consequences for both physical and psychological health of that person. Stigmatization of obese children threatens not only their health but also generates health inequality and interferes with effective interventions that help reduce social stigmatization and help their overall health. Often, people who are obese experience stereotypes such as being lazy, weak, unsuccessful, unintelligent, and many more. These types of stereotypes give way to stigma against those who suffer from obesity. Research often suggests that the overweight and obese youth are often subjected to bias and stereotypes by peers, which results in delaying their social, emotional, and academic development and may result in adverse medical outcomes such as hypertension and diabetes. Stigma encounter can be done in various ways, such as name calling, physical bullying, and victimization. For example, through social exclusion, being ignored, or being a target of rumors. Children who face being overweight or obese problems are also faced with not only health issues but also mental, social, and physical concerns. It can negatively impact a child's social well being as their self esteem may be adversely affected. It has been proven that obese and overweight children have lower self esteem levels than non obese children, especially regarding their physical activity participations in school activities and or community programs. Research also shows that negative attitudes towards overweight children have emerged, and they are often expressed verbally in relation to their body image. Discrimination of overweight children also happens in settings of healthcare, education, and social interactions. This can in return impact the psychological aspect of a child as it affects their ability to develop a healthy and confident self image and can often impact their mental health when they become adolescents. If the child's parents, teachers, or peers constantly remind them of their body image, it can cause serious consequence for their mental health and can result in them being suffering from depression, anxiety, and even loneliness throughout their life. Overall, children who are overweight or obese face social exclusion and isolate themselves from their peers. This can result in refusing help from others in order to help reduce the risks of developing serious health problems and can make them reject interventions that relate to their. Thank you so much for listening.